We're going to do a little Q&A
Sure.
before. So, Dr. Horowitz, do you have any, are you treating with low-dose immunotherapy for Lyme?
The low-dose immunotherapy is interesting. I actually haven't done it. I've spoken to some of my colleagues who have been. I mean, I think it's a promising treatment for some of the people, but I would love to see some statistical analysis of it, because unfortunately we really do need published studies. But you know, the talk about it on the street as far as how people are doing is some people are definitely getting better, and it would make sense because this overstimulated immune system, you've got to get the immune system in balance, and it may be that the LDI is actually a good therapy for people who can't take some of the stronger drugs we've talked about. But a good controlled study just does need to be done on it.
If diagnosed with Lyme, how long after treatment should one consider trying to conceive a child?
That's a good question. I mean, you want to be well, and especially with babesia, because the problem is babesia get transmitted to the fetus. One of the stories I'm going to be putting, I don't think I'll have room in this next book, the third one, but I had a woman, in fact, I spoke to her just a couple of days ago. She was on her third pregnancy, and she relapsed during her third trimester with babesia. And babesia will cause a hemolytic anemia in the fetus, and the fetus can die at birth and be very sick. So we treated her with clindamycin, Mepron, and Zithromax. You can't use these drugs in early trimesters. The baby was completely healthy. And she had come up actually from the south, and her fish was positive. The fourth pregnancy, the next pregnancy afterwards, she did the same thing in her third trimester again. And again, the baby was healthy. So what I would suggest to women who want to get pregnant is first get healthy, clear out the toxins, get as many of these co-infections as you can. I really tell women, kick the babesia as best you can before wanting to consider getting pregnant. Because the problem with this is that with pregnancy, there are certain drugs you can't use in early stages of pregnancy. You can use cephalosporins, they're category B, like Ceftin. You can use Zithromax, but Zithromax does not cross the placenta. So it's good for the mother, but it has no effect for the baby. So it's good to clear out the infections, clear the toxins, get healthy. But as I said, in this last couple of weeks, we just had several women give birth, healthy babies, even despite the one that had the positive mycoplasma PCR, the babies have been fine. We found that women during 9 months on Ceftin Zithromax or Omnicef Zithromax, it does protect the babies. So you can get pregnant really at any point, but I'd suggest getting healthy and being strong, especially with the parasites. Clear out the babesia if you can.
Why is it so important to minimize spikes in blood sugar?
The bugs love sugar. One of the most important thing in a diet, just like we were talking about paleo and Mediterranean, you've got to get off sugar. Sugar drives inflammation. So this whole day I've been talking to you about what drives the inflammatory response. That's a great question. Sugar is actually one of the big ones. Probably half my practice has hypoglycemia, where they don't get enough protein balanced with complex carbs and healthy fats, and they drop their blood sugar. And what the Lyme patients will tell me is once you drop your blood sugar, all your Lyme symptoms get much worse. So you'll get worsening fatigue, worsening pain, worsening cognitive functioning. Very important to keep down the sugar. Yeah, that's a good point.
We're just going to take a couple more questions from the audience. Anybody?
Hi, Dr. Horowitz.
Hi.
One of the problems that we're, one of the problems we're having, I live in the Buffalo, New York area, and...
I just met a patient from Buffalo.
Oh.
Why can't I meet a patient from normal parents? Thank you very much. I've been waiting to give that line for a while. Those with neurocognitive functioning may need an explanation of that joke.
The biggest problem that I'm finding is we started a support group in the area, my husband has Lyme, is that the doctors in our area are absolutely refusing treatment. Just refusing it, do not want to acknowledge it. And unfortunately, I have a lot of people calling me now, and I'm not a doctor, but I'm trying to offer the best advice I can to these people, parents and patients who've been sick for such a long time. I've had doctors look at me, flat in the eye and say, "There's no such thing. You're crazy. Stop telling these people this." So my question is to you: is what do I tell these people who are so desperate for help and just can't get medication, and then are trying to get into LLMDs, but are obviously on waiting lists, and what should they do?
So for the doctors that don't believe it, there is a way to put together a bibliography. I know on the ILAD's website, I think Dr. Bransfield helped to put this together. There's hundreds of references of persistent Lyme. So today I just showed you a couple of them on the slides. Doctors need scientific references, right? They need to see it. They need to understand why infectious disease doctors would have said there's no such thing as chronic Lyme. But they're basically looking at those double-blind NIH studies, which if you look at the DeLong literature, which reanalyzed them, people actually did get better. It's unfortunately, that's the political aspect of the disease. It's not the medical scientific. If you look at the science is definitely showing persistence. That's not an issue. I think the recent work out of Hopkins and Kim Lewis, I think it's useful to show to doctors, as well as the work on biofilms, because it would explain in the past why some people may not have gotten better even with longer term treatment. We didn't know the biofilms were there. We weren't using biofilm busters. I was using Bactrim receptor for a long time, not knowing it was a persister drug. Maybe it just has to be used longer, but the point is the literature is there. The doctors need to look at the poor sensitivity of the testing. They need to look at the number of species of Borrelia. They need to look at the science. So you could put together as a Lyme group a packet for doctors. I mean, a lot of it's in the back of my book, but just put together something for them, right, to show them the science. I think that's a good first starting point. But the reason the doctors don't want to do it, truthfully, has more to do with the political, is that, you know, now in New York State, the governor signed the bill basically protecting doctors for treating Lyme disease. Governor Cuomo signed it into law over a year ago. But the doctors have been scared because of the political situation that exists. And unfortunately, you've got a spreading epidemic across the United States and across the world, and doctors are scared to treat. I mean, it's beyond dysfunction. It's scary as far as that the leaders aren't getting this, and that's why, by the way, why I spoke to many people on the top political levels, including recently Hillary's policy person, Ann O'Leary, who I had a long conversation with about this. I just spoke to Zephyr Teachout, who's running for Chris Gibson's seat in Congress. I try educating the politicians as best I can about this, about the people in their area. But unfortunately, the doctors, they've really got to be educated on what the science is, how sick their patients are. They are protected in New York State at this point, so they should not have the fear that they had from before. But unfortunately, that fear, I think, still exists.
And I think like the biggest thing too that I've been finding is the doctors will just tell us it's not here. Where did you go? Right. It's not here.
Right.
So you must have gone out of state, or you must have gone over, you know, the border for an hour to Pennsylvania. That's another thing that patients are finding is they're refusing to say it's in the Buffalo area.
Well, you could get SUNY Buffalo. I know here, for example, Binghamton has done studies on it. So has SUNY Adirondack with Holly Ahern. I'm doing a paper right now with SUNY researchers from New Paltz. So the SUNY system actually has been great as far as actually moving it ahead. You may want to get SUNY Buffalo to take a look at some of these guys to take the ticks and to start analyzing them for what's in the ticks, because as I showed you from the ones from New York State, we're finding Borrelia burgdorferi, Borrelia miyamotoi, anaplasma, Powassan virus. You can be very surprised. Babesia, you can be very surprised when you see the co-infection showing up. And that again would be a way to try and validate for the physicians that they have to be careful with the tick bites.
We have time for one more question.
Sure.
How concerned do we have to be with toxins in supplements, especially pesticides?
So the question as far as toxins and supplements, I mean, normally it's true that the FDA doesn't always well regulate the supplement industry, but they are regulating it better. Some of the companies that I use have had to go through, in fact, the FDA has come in and actually made sure that they're clean. They use mass spectrometry to make sure that there are no pesticides and heavy metals. It's something that you need to do. It's kind of, I say, for whatever companies you're using, several of them have those type of good manufacturing practices with GMP, where they've had people go in and check the supplements. And one company in particular they use a lot, the FDA have gone in actually several times, and they're above manufacturing facilities for medications. That's how good one of these companies is. So just know you have to do your own homework to see, because some of the things coming from different companies, Oprah did a piece on this actually years ago, where she found all kinds of things in supplements across the US. It's a problem. There's no doubt it's a problem, but it's also a problem, truthfully, that you have 300 to 500 toxins getting into your body from the environment. Not explains it away. We have to be careful with it all. But I do think this issue of toxins and detox, it's an issue that has to be dealt with. The point I made today was infections, toxins drives inflammation, right? We're just not paying enough attention to these chronic persistent infections and chronic toxins getting into people. That's driving a lot of the inflammatory response. But I do tell people to do their due diligence. It's a good question. So thank you. I'll be up there signing books for anyone who, I came a little bit late, but if you need me to sign a book, you want to learn about other stuff, I'll be up at the table over there.
Thank you,
doing
Dr.
signings.
Horowitz.
Thank you.